Am I unmuted now?
Yes, good morning.
Good morning.
Hi, Mariam.
Hi.
If everyone could just hold on for 1 sec. We're just trying to figure out some of the technology, and we'll be right with you.
Okay. Can you hear me okay?
Good morning. I'd like to welcome all of you today to NYSARC's Quality Improvement Initiative. I know most of you on the call. I've met most of you in person. I do know that we have a fairly large group, and there may be some individuals who have not met me yet. My name is Erik Geizer. I'm the Assistant Executive Director for Quality Improvement and Compliance. I've been with NYSARC since April, and one of the tasks that I was given when I first started was to try to move quality improvement forward in the NYSARC organization overall. So today we're going to focus on quality, some of the steps we are going to take as an organization to move quality forward, and hopefully answer some questions and take some feedback from all of you today. A couple of housekeeping items. Many of you might have better luck on the telephone rather than listening to the conference over computer speakers, but that is certainly, you can go either way with that. I will allow the phones to be unmuted. If background noise becomes excessive, I will put everyone on mute and unmute at times for periodic questions, comments, and feedback. So that being said, we'll get right into it. I don't think we're going to take the full 2 hours, but that'll depend on the feedback that we get from all of you. Okay, so the agenda for today, really 7 items we want to cover. We're going to have some opening remarks from Marianne Bruner, who is our chairperson for our Quality Standards Oversight Committee. We'll go through some background on the Quality Improvement Program and how this all came to be. I do want to take time to acknowledge the members of the Oversight Committee and also the Professional Work Group for all their hard work and their effort. And then we'll get into the steps that we're going to undertake as an organization to implement the quality framework, which includes development of quality improvement plans for each chapter and annual quality metrics, which we would ask chapters to submit to us on an annual basis. And then we'll have time for some conclusion and some question and answers. Okay, that being said, I'm going to turn over the audio to Marianne Bruner for some opening comments. Marianne, are you with us? Marianne?
I'm here.
Okay, sorry.
Okay, can you hear me?
Yes.
Okay, very good. Yes, good morning, everyone. I'm suffering a relapse of the flu, so if I have a coughing jag, please forgive me. I'd just like to make some initial comments here. On behalf of the Quality Standards Oversight Committee and its professional work group, comprised of chapter quality improvement staff from many chapters across the state, I welcome you to our first webinar on NYSARC's Quality Improvement Initiative. As you may have read in the recent chapter bulletin on NYSARC's Quality Improvement, what we are about to review is the result of a diligent effort over a 2-year period that establishes a solid framework for measuring and ensuring quality of life for the people we support. It is no longer sufficient to say that we are doing good work because we are dedicated to our mission. We are now in an environment that demands proof. Also, and most important, we have evolved in the field of developmental disabilities to recognize and foster self-determination, personal choice, and person-centered planning in an effort that enables our people to grow and thrive. The people we support, their families, and our staff must not only have an active voice in what we do, but also must have a sense of satisfaction to the fullest extent possible that life goals, desires, and interests can and are being realized. What we will present today represents the beginnings of our best effort to embark upon a statewide initiative that provides overarching standards and quality metrics that indeed will reflect the proof of our dedicated labor. This quality improvement process is all about acknowledging and applauding our successes, and with supportive expertise offering assistance to improve any areas that need to be corrected or strengthened. As pioneers in this statewide quality initiative, we embrace your thoughts and feedback as together we engage in this most important effort. I want to especially acknowledge the enormous and outstanding effort of our NYSARC staff, Erik Geizer and Tanya Seberg, for shepherding us to this point. And now I will turn this over to Erik to walk us through NYSARC's Quality Improvement Program.
Okay, thank you, Mary Ann. The first slide, I wanted to put up a definition from Merriam-Webster of quality, because quality, one of the challenges we have in terms of quality is, what does it mean? How do we define it? In terms of its formal definition, quality can stand for how good or bad something is. In terms of where we want to go with quality, the third definition really applies, where we want to use quality to perform high level of value or excellence in the services that we provide. So we use quality to measure, and we also hope to reach high quality as we continue. Okay, so a little background on quality. What is quality? Quality is one of those things that you kind of know it when you see it, when you go into a program. It's a very hard thing to define for the healthcare field. The analogy I like to use is an experience, let's say, in a restaurant where you go for a meal. A lot of factors go into how you might define whether or not that's a quality experience. Obviously, the food itself, the ambiance in the room, the staff attentiveness, the price and value for the meal. So these are all things that might go into the equation of your overall quality experience. What makes it particularly challenging in our field is that when we go to the restaurant, that's our experience. What we're trying to do in terms of quality in this field is measure the overall experience for the individuals that we serve. So that makes it kind of uniquely challenging, and something, as Mary Ann indicated, that I'm not aware that anyone else in the country has really perfected the measurement of quality yet. So this will evolve over time, and we're just at the beginning stages of our quality initiative. Some things are pushing quality forward. One of the things that's pushing quality forward is the managed care initiative in New York State, the DISCOs. Quality will be a key component of measuring outcomes for individuals who are enrolled in our DISCO or other DISCOs. I'm sure all of you have seen for Medicaid or Medicare different plans advertising we're a 3.5-star plan or a 4-star plan. Those are based on quality metrics, and the amount of reimbursement that managed care companies get are dependent on the quality that is being measured at the managed care company. So quality is going to be very, very important as we move towards managed care. It's also going to become easier as we move towards managed care because as a managed care organization, we will have access to all of the claims data, and we will be able to do huge amount of data analysis on treatment, on types of services people are getting, timeliness of appointments, timeliness of prescription fills, things of that nature that right now we really can't do. We also have OPWDD emphasizing quality. Recently, in the last year, 2 years, OPWDD has been pushing quality forward extensively. And not only are they pushing it forward, verbally and through guidance, but there are regulations that will be coming out probably later this year that are going to require quality components. The draft OPWDD governance regulations, which have not come out yet but have come out for some comment, indicate that quality improvement plans will be required for providers, that they will need to be reviewed and approved by the board of directors annually, and that the quality improvement plan shall include goals and objectives and a process for measuring compliance and quality of the services provided. So I think NYSARC is taking the lead and trying to get out ahead of this, but certainly there are a lot of other contributing factors pushing quality forward, and OPWDD is certainly one of those. A little background on NYSARC's quality initiative. As Marianne indicated, back in 2012, the Board of Governors of NYSARC established the Quality Standards Oversight Committee, which Marianne is the chairperson of. And the resolution essentially reiterated NYSARC's commitment to quality, established a quality initiative, and began to discuss quality metrics. How are we going to measure this thing called quality? The resolution also established a Quality Standards Professional Work Group. And the way I like to think of it is the Quality Standards Oversight Committee kind of sets the goal and the agenda for the organization, and then the Professional Work Group actually puts the nuts and bolts of how do we get the quality improvement program going. And the Professional Work Group is made up of quality professionals from many of our chapters. The overall goal for all of this, of course, is to put in a quality framework across the organization, and we're going to do that by assisting all of the chapters in developing quality improvement plans, and then developing a system of reporting and metrics which we will be able to utilize here at State Office and feed back to the chapters in terms of how we are doing in terms of our quality of care. So these are the responsibilities as outlined in the resolution. The QSOC is going to assist the chapters in developing the quality improvement plans. The QSOC, through me and NYSARC State Office, will be collecting and analyzing data from chapters. We will be reporting quality concerns and organizational quality trends to the NYSARC governing body. A couple of other things that we do as well. For each instance where a program receives a 45 or 60-day letter from OPWDD, NYSARC actually makes a site visit or multiple site visits and assists the chapter in responding to those situations. We make sure that the chapters are responding to deficiencies appropriately and thoroughly, and we arrange quality training programs throughout the year, and we'll discuss an upcoming one in February towards the end of this training. Just to acknowledge the members of the Quality Standards Oversight Committee, again, Marianne is the chairperson, and the individuals listed below have all volunteered a lot of their time and effort towards moving quality forward, and I do want to acknowledge all they've done to push this very important agenda forward. I also want to take a special moment to thank and acknowledge all of the people who have contributed to the professional work group. These are all the individuals who have participated in the process. They have really done the nuts and bolts in terms of the work, coming up with the metrics and the definitions and feedback on quality improvement plans and sample plans. And that's in addition to all of their regular duties and responsibilities at their individual chapters. So they've really contributed a lot of their own time and effort, so we thank them, and we also want to thank their executive directors for allowing them to participate and move our whole organization forward. Okay, so I'm sure all of you are asking now, well, what's required of me? What is this all about? How much work is there going to be involved? My goal today is that you'll leave hopefully not overwhelmed with the work, and I think as we start to go through some of the requirements, you'll see that most of this material is already being done at the chapter level. It's really about putting it into a comprehensive plan, a written plan, getting the board approval of that plan, and then of course the data submission to NYSARC. And most of the data is stuff that you're already accumulating and reporting on at the chapter level. So I hope you won't feel too overwhelmed as we start to go through this. It's just a little qualifier, just like anything else. We're at the very beginning of the initiative. It's a work in progress. We've had a lot of debate and discussion about the metrics and the quality improvement program, and this will improve over time. So there may be changes that happen along the way, but we certainly will be cognizant of all the time constraints that all of you have out in the field. Okay. Before I go on, maybe I'll just stop for a minute and see if anyone has any questions at this point. Okay. Hearing none, we'll go right into the quality improvement plan. So what are our expectations as an organization in terms of a quality improvement plan? Okay, first of all, we recognize that there are a lot of time challenges, the Justice Center, regulatory changes, OMIG, CMS. We understand and recognize how busy all of you are. We wanted to give ample time to develop these quality improvement plans. We all came to the agreement that 6 months would be a reasonable amount of time. So we're really looking at the end of July and early August of 2014. The Oversight Committee and the Professional Work Group developed user-friendly guidelines. I sent out an email earlier this morning that had the Quality Improvement Program guidelines to you, along with a couple of other documents which we'll touch on a little bit later. And we're going to go through them in this slideshow as well. One of the documents that I sent out this morning is a QIP evaluation tool. So what you can do with this tool is when you are developing your own quality improvement plan, you can use it to make sure that you have all of the required elements covered and included in your plan. I should also note that here at NYSARC, when we receive a quality improvement plan in 6 months, we will also use that quality improvement evaluation tool just to make sure that all of the components are in there. We will be providing sample plans and guidance materials. We recognize that some chapters like to do things independently and with less guidance. Other chapters may need more guidance. We presently have 4 quality improvement plan samples that we are going to be sending out probably in the next week after this video conference. And it ranges from very prescriptive, very detailed, to just high-level topics that the chapter could build upon. So you really will have a variety of sample or model plans to choose from as you work in the next 6 months to develop your own unique plans. Okay. I also want to let folks know that we are not going to be overly prescriptive. We are not telling the chapters how to do this, what to write, what to say. And we recognize that there's a lot of different ways to measure quality. So we are not going to be analyzing your submissions to the extent where we're going to, quote unquote, nickel and dime you with one piece missing or this piece missing. We just want to make sure that the major content areas are covered and being measured in some way appropriately. So just to give everyone peace of mind. Okay. So what are the required elements in the quality improvement plan? Well, first is that your quality improvement plan will need to address in some way certification reviews, okay? The number of reviews, the number of deficiencies. So in your quality improvement plan, you're going to need to address how you manage program certification reviews, how you respond to statements of deficiencies, recommendations, best practices, how plans of corrective action are developed.
Is there a position posted? Do you know what she told me? What? Yeah, they thought it would be a good idea because...
If I could ask everyone to place their phones on mute. Okay, thank you.
And I said, in this protocol idea...
All right, hang on, I'm going to put everyone on mute. Okay, there we go. Sorry about that. I'll open up the lines every few slides for questions and comments. Okay, so there will also be a report on plan approval and need for additional improvement. And this will become clearer, I think, when you get the model plans. You'll see how this information is incorporated into the quality improvement plan. Okay, the second element that's a required part of the plan would be your chapter incident review committee annual report and data. This is stuff that the chapters are already doing. We know in 624 there is a requirement for the development of an annual report and review of trends and patterns. You would simply want to formalize that process into your overall chapter quality improvement plan. When is that done? Who is it done by? Who is it presented to? What recommendations will come out of those types of reviews on an annual basis? So again, that's work that's already being done. It's just that it hasn't been pulled into one formal quality document. The third element is quality improvement reviews by non-regulatory agencies. So, and there may not be many of these, but on occasion there may be some. But you may be reviewed by, let's say, IPRO or JCO. They may come in and do various types of quality reviews. Certainly when that happens, you would want to incorporate into your program how you'll handle those types of reviews and how you'll respond to those. The fourth element is self-audits. Self-audits are already occurring at all the chapters. We know through the compliance regulations that there has to be a system of risk assessment and also self-auditing that occurs. It's just a basic part of the function of the work we do. But we probably need to pull that into the plan and, again, formalize the process for how that's going to occur. How are we going to assess what risk areas we have in our chapters? How are we going to determine which areas we want to audit? And when we have findings from our self-audits, how are we going to respond to those audits and ensure that any deficiencies are corrected? So that process itself should be outlined in your quality improvement plan. And again, you probably already have a process for doing this. It's just a matter of putting pen to paper and formalizing it into this quality program. Okay. The fifth element is satisfaction levels of the people we support. There are questionnaires and surveys that we will be sending out as samples that will hopefully measure this satisfaction levels. Obviously, we know many of the chapters are involved with CQL, and that's certainly one component that could be used. But you may want to expand it to include satisfaction levels for family members or guardians, for those individuals who maybe can't articulate or have difficulty articulating their feedback in terms of the services that are provided. So a number of chapters have already employed various satisfaction surveys. And again, we will be sending out guidance materials and survey samples to all of you for consideration and potential use. The sixth component, obviously, and certainly not least, the staff members that work for us and provide the critical services. We need to know if we are providing them the tools that they need to provide quality services. We need to know where they're not feeling supported, and we need to provide them with the training and the talent and the abilities to allow them to do the work that we need and expect for the individuals we serve. Again, just like with number 5, we will be sending out a variety of satisfaction tools for employees, and you certainly are more than welcome to use those survey instruments. I do know that many chapters, if not all the chapters, already have some sort of questionnaire or self-assessment for staff members that they turn in on an annual basis. And you certainly can go ahead and continue to use that. It's just a matter of, again, formalizing the process by which that will be done. And what will you do with the information once you have it? Okay. Item 7 is an assessment of the quality of life of the people we support. Now, 7 and 5, there is some overlap. I recognize that. Item number 5, I guess, would be geared more towards chapters that haven't employed CQL to date, or number 5 could also apply to parents or guardians in terms of their perception of the services we are providing. 7 is total emphasis on CQL, and most of the chapters are in some are already working with CQL, have begun the process. Some are farther along in that process than others. There are a few chapters that have not participated in CQL to date. A couple of things on CQL. CQL is not something that NYSARC is necessarily pushing, although we certainly believe in CQL, but it is something that is really being pushed by OPWDD, and recent guidance and seminars that we have attended indicate that while they're not going to require the use of CQL per se, they are going to be requiring that chapters measure for all 21 performance outcome measures that CQL uses. So to me, that's kind of code for you really are going to need to use CQL. So we're going to encourage chapters that haven't begun the process to incorporate into their quality improvement plans how they're going to start to initiate the CQL programs within their own chapters. And those of you that are already using it, how you are using it, what are you doing in terms of a measurement, the formality of that, and how are you using the results and pushing quality forward through that CQL process. The 8th element is the human resource issues, such as staff retention, OSHA reportable injuries, staffing levels, and staff development programs, such as training programs. Again, these are all things that are most likely occurring at all of your chapters, although they may be occurring in different departments, such as the Human Resource Department. The Human Resource Department is required to obtain data and information on OSHA reportable injuries. But by pulling that information into our overall quality improvement program, we can start to get a better sense of what's going on for the individuals who work for us, the staffing levels and where deficiencies might lie, and staff training needs. So we'll be pulling in information from a number of different areas into this overall quality improvement program. Okay. The 9th, and I would argue maybe the most important, is board governance and review with an attestation of the quality improvement plan. You know, the board governance historically has been one of financial oversight and stewardship, and certainly that is very important. But as we move forward, the board is going to need to become more involved in what's really going on in the programs that you offer, and become more invested in where there are problems, that those problems are getting rectified. There's a number of pieces of this. I apologize for this being so small. The first bullet, obviously we want to make sure that the chapter has an updated mission statement, and the board reviews the mission statement to make sure that it is consistent with the desire of the chapter to provide the services that they are providing. Obviously now in regulations, there is a requirement for board participation on the Standing Committee for Incident Review. At least one board member has to be on the Incident Review Committee, although you certainly could have more. There's nothing prohibiting additional involvement from the board, and I certainly think that would be a very proactive position. One thing that we are going to emphasize is we really want our board members to be visiting our program sites. We really need to get additional eyes on all of the programs that we offer. And to do this, we have developed a number of different templates, which are site visit templates that a board member could use to go to a program to evaluate how does it look. Remember, we go back to the old, you know it when you see it. Your board members don't need to be sophisticated in regulations or rules or requirements. They can get a sense using a simple checklist or template as to whether or not the program is clean, whether interactions are positive, whether there are physical plant issues. So your quality improvement plan is going to need to incorporate that expectation of your board members that they are going to need to be out at some sites throughout the year and report back on what they find. Obviously, your board will want to know and will need to know how the chapter is doing on self-surveys and regulatory surveys. Many of you are already doing this through your corporate compliance committees and giving feedback to the chapters on how audits are going or self-disclosures, just to make sure the board is fully informed. Again, you're going to want to formalize how that happens and how you're going to feed that information back to the board. Also, kind of in line with that previous bullet, board awareness of the state or federal regulatory authority communications. So if you get deficiencies, if you get a statement of deficiencies or a 45 or 60-day letter, that is something that certainly the board should be aware of and should be monitoring and overseeing to make sure that the chapter is addressing it appropriately. Okay, also board assurance that senior management has the means to assess adequacy of staffing levels, staff competence, and staff performance with a mechanism to address deficiencies. Many boards will have HR committees, obviously, or training and development committees. Again, so a lot of this work's already occurring. It's just a matter of formalizing the process and how that all impacts on quality for the services we provide. Board assurance that the chapter has a plan for ongoing staff development and training. And board assurance that expectations for ethical conduct be communicated and reinforced for chapter employees, volunteers, and board members. Okay, and lastly, and certainly not least, we want board assurance that the chapter's practices are consistent with self-advocacy for the people that we are supporting, and that individuals are living in the least restrictive environments with the most choice available to them. So these are all things that can be done through your regular board meetings. Certainly you could develop forms that these items have been incorporated into the plan, and the board could sign off acknowledging those things. But again, I believe these things are already occurring at all of our chapters. It's just a matter of getting it all in one place. As I mentioned earlier, there is a quality improvement evaluation tool. There's nothing fancy about it. It essentially just goes through those 9 elements that we just went through now, and you can just kind of check off that you've covered all of the areas. And once you've checked that off, your plan should be ready to be submitted. We will also be evaluating the plans as they get submitted to us here at NYSARC. So you can kind of, you'll know in advance whether or not your plan meets the expectations just by using the evaluation tool. And I sent this out in the attachments earlier this morning. Okay, let me stop here before we move on to the data submissions that will be required on an annual basis, and see if there are any questions or concerns or comments on the quality improvement plan. Let me unmute everyone. Okay. Okay. Can people hear me? Can they, any feedback? I think if you may have your own phones on mute, because I have unmuted all the lines. Okay. All right. Seeing no questions, we will continue on to the data submission to NYSARC. And this is really where we're going to take information provided at the chapter level. We're going to synthesize it and analyze it and provide feedback to the chapters on how they're doing and how we are doing overall as an organization. Okay, I put this slide into the slideshow. I guess just to make sure that everyone understands that we appreciate some of the challenges with data. Data, if used incorrectly and unfairly, can be, very damaging. It can tell a very biased story. So we are certainly aware of that. We know there are lots of differences between the chapters and all of the programs in those chapters. And we're not out to get individual chapters, so to speak. What we are trying to do, though, is establish a mechanism where we can oversee the overall quality of the organization. We do not plan to use the data in a negative way to attack a chapter. Certainly, there may be questions that come up that we reach out to a chapter and ask some additional questions, but we're certainly not going to ever do a slideshow where we say Chapter A had 100 deaths and Chapter B had 2 deaths. So Chapter B must be much better than Chapter A. Obviously, a lot of factors go into that. In fact, questions could be raised. Why are Chapter B's death reports so low? Perhaps they're not reporting as they should be. Are the sizes of those 2 chapters similar? Or are there differences in the number of people they're serving, which would certainly account for some of the additional death reports? So we will be very cognizant of that as we start to manipulate and analyze the data. Okay, this is the NYSARC Quality Indicators Reporting Form. It may look a little overwhelming, but I think as we start to look at some of the metrics included here, you'll see that most of these things are already being reported or gathered either by the quality department, the compliance department, the HR department. Again, it's a matter of pulling it all together and reporting it consistently so that we'll be able to analyze it. And we'll look at each of these in more detail. Your first question is probably when the data report will be due. It will be on an annual basis. It most likely will be due February of the following year. So for example, this year's data would probably be submitted in February or early March of 2015. That should allow enough time for incidents or staffing changes that occur in late January to kind of work their way out so that the data will be more consistent. And our goal is really to allow you time to get quality data and to coordinate with your incident review committee analysis and report. And we don't want to duplicate efforts, but if we can knock off two things at one time, we think that it will reduce the burden on the chapter. And you'll see a lot of the metrics are specifically related to incident review committee and incident management. Okay, I'll just check in. Is any questions on what we've covered so far for the data submissions? Okay. All right. So we will go right into the metrics and what we are looking for, and what I provided you all this morning was what's called a data dictionary. The data dictionary provides definitions for all of these metrics so that we can make sure that all the chapters are reporting consistent information to us. And we spent a great deal of time going over these metrics and the definitions to make sure that they made sense. Some of these may change as we go forward, but this is our starting point, and we will certainly adjust as we get feedback. Okay, so some metrics that we are looking for in terms of general program and operation. Okay, number one, the approximate number of full-time equivalent staff, and you can see the definition below. We are looking for full-time equivalent. This is the same figure that is reported in your CFR data and reports, so that should be pretty easy to obtain. We are looking for staff-related injuries as defined by OSHA. And some of you may be saying, well, how does OSHA define that? I've actually developed some guidance on the OSHA definitions of injuries. Your HR departments should know what that is, and they should already be collecting data, but it's a matter of pulling that data into the data submission report for NYSARC. The approximate number of unduplicated individuals served in all programs. Again, we don't want to count an individual if they're getting residential and then they're getting day program and they're getting MSC 3 times. We would count that individual unduplicated manner. We'd count that as one individual. And this will give us some way to kind of normalize and stratify the data so we can see how many people you're serving versus how many people other chapters are serving. And it gives us some sense of whether your data is in line for the size and characteristics of the chapter as other chapters. Okay. Number of participants in day activities. The total number of individuals being served in day activities and supports, and we have provided a list. It could be day hab, day treatment, day programs, pre-voc, workshops, community hab, respite, or SEMP. And we're making a distinction from folks that are just receiving day activity services to the number of participants in certified residential programs such as IRAs, ICFs, community residences, and supported and supportive housing. So we'll have a number for individuals being served for day activities and individuals being served in residential programs. These are numbers that the chapters already have, and we do recognize too that there may be individuals who are in both. Okay, but it gives us, again, another way to look at the data more fairly across chapters with a wide range of characteristics. We struggled with this last element. We are asking for the number of participants gainfully and competitively employed, and we had a lot of debate about what that really meant. But what we are not looking for is individuals who are in a workshop setting. We are looking to see the number of individuals that you serve who have been gainfully employed, and we're defining that in jobs earning at least a minimum wage. Okay, so that could be out in the community. It could also be within your program. Let's say you hire an individual with a disability to perform routine tasks around the chapter, but you're treating that individual as an employee of the chapter. Certainly that would count. Okay, so we are not looking again for individuals in a workshop setting. We believe that that would probably be captured in number 4, day activities. But if your individual is gainfully employed and earning minimum wage or more, certainly they would be captured in this category. Statements of deficiencies. And I do want to qualify this section by just letting you know that we also here at State Office do receive all the statements of deficiencies and all the POCAs, and we do enter a lot of data into our system. But this will be an opportunity for us to make sure that we're getting all the same information that you're getting. Also, there are some programs that, even if there are no deficiencies that are identified, still receive a statement of deficiencies, which doesn't make a lot of sense, but this will help us make these statistics more consistent. So we would want to know the number of reviews conducted at the chapter during the year. Okay. We would want to know the number of certification reviews that actually resulted in the chapter responding via a plan of corrective action. And by looking at these two figures, of course, we can get a sense of how many of your reviews, what percentage of your reviews are resulting in some sort of formal response. And then we can look at that percentage across all the chapters to see, what chapters are struggling, may have higher levels of deficiencies, and may be required to write POCAs more frequently than others. Number of 45 or 60-day letters received. We will also know about that here at State Office, but this is kind of a good checks and balances just to make sure that we have been informed and notified of all of these incidents. And again, we are required to make a site visit if a chapter gets a 45 or 60-day letter. Okay, so now incidents. This is the third component of the data submission. We made this conform to all the regulatory changes and the Justice Center and the new definitions. All of these things will be already being completed for your incident review annual report. The first is the number of reportable incidents as they are defined now in 624. The number of allegations of abuse and neglect, and again, that's allegations. We just want to know overall how many allegations were made, and we can use that number to compare it against how many of those allegations were substantiated, and that makes the abuse and neglect data a little more robust, because we recognize some chapters are going to be reporting more things as allegations of abuse and neglect, and some chapters may report things less. There is some interpretation in terms of the current definitions. So by capturing the data this way, we think it'll give us kind of a leg up on how to synthesize those numbers. We also want to know the number of pending abuse and neglect investigations. So at the end of the year, we recognize not every investigation will be closed. Certainly with the Justice Center and how long some of their investigations are taking, there are going to be many cases that at the end of the year are still going to be open. We may have to back out some of those open or pending cases of the data analysis to make sure that what we're reporting back to chapters and the organization is accurate. We're also looking for, I know I spoke about reportable incidents, but we're also looking for notable occurrences. So again, that's defined in Part 624. Those are the occurrences that are reported to OPWDD and not necessarily the Justice Center. the number of individual deaths. As a reminder, deaths are presently required to be reported to state office within 5 days of the discovery of the death. We have certainly seen improvement in the reporting, more consistent reporting, but we also know that some chapters have struggled to get us all of the information, and things can slip through the cracks. So again, this is just a metric where we can verify that we've received notification from you throughout the year of the deaths that have occurred in your programs. 7, the number of incidents or occurrences resulting in law enforcement notification. Okay, and we for the purposes of our data, we're not including reports to the Justice Center as law enforcement notification. We are considering just those that are reported to a police department or state police if they come to your program in response to a situation or an incident. Metric 8 is the number of program participant injuries resulting in notable occurrences. Now, there is actually a definition. One of the items in notable occurrences is injuries. There are minor injuries and there are major injuries. And all of these would need to be reported to OPWDD. We'd like to know how many you're having at your program that are either minor or more serious. But again, this is numbers that you're already tracking and trending. Okay. Before I get into the next steps, I'll open it up again for any feedback or questions about any of the metrics or data points that we've just gone through. Marianne, are you on the line? Okay.
Yes, Eric?
Yes.
Yes, okay. I'm just wondering, wanting some feedback from our participants at this point. I mean, as Eric has indicated several times, much of this data, if not all, we are already collecting in various forms and reporting. What are people thinking at this point in terms of what's been presented?
Hold on, Marianne. I'm sorry about that. Okay, sorry about that, Marianne. We're trying to make sure. I'm trying to make sure the audio is allowing folks to speak, and I'm not sure it is.
I don't think, as the screen said I was muted before. So I was just asking for people's feedback up to this point, given, Eric, that you've repeated several times that much, if not all, of this data is being collected. How are people feeling at this point regarding the kinds of metrics and data that we're talking about?
Okay. It looks like we're having some difficulty allowing individuals to communicate. I am getting some questions through the chat box.
Right.
And we will see if we can unmute everyone. It's we're having some technical challenges. We may not be able to get that feedback right now.
Okay.
So I'll just continue with the next steps. Okay, chapters have already received the QIP guidance document and the QIP evaluation tool. As I've mentioned, there will be other items coming. There will be sample QIP plans, sample survey tools, and that will include like satisfaction surveys for employees and for parents and guardians, as well as board member site visit materials. This morning I sent to everyone the data reporting form and the data form dictionary, and that will include some guidance on what an OSHA injury is defined as. But again, your HR departments should certainly know that information. Okay, I just wanted to mention a couple of other things. I know there are a few questions in our chat box. I'll try to go through them. But at the end of February, we will be having our first, actually our second Quality Oversight Committee webinar. The webinar will be on individuals with disabilities and crime victimization. The facilitator is Scott Modell. I know Scott quite well. He is with the state of Tennessee. He's the Deputy Commissioner of their Department of Children's Services, and he's a tremendous presenter. We're really fortunate to have him participating, and I'm hoping all of you on this call today will be able to participate in that webinar, which I'll be sending some information out as well on that in the upcoming days. Okay, I'm going to go to the chat box, and I'll try to answer some of these questions. Okay, well, first question is, will the PowerPoint presentation be forwarded? Yes, we will be sending out the PowerPoint to all of the chapters. It's also being recorded, so it will be available for individuals to listen. Although we've had trouble getting the dialogue going, certainly people will be able to listen to me do the presentation. Okay, the next comment is, some of the assurances for the board are already happening through their knowledge on topics and oversight, but some of it is more passive than implied in our QIP governance. That's number 9. Will there be feedback directly to the board on best practices or practical methods to achieve their assurances, not filtered through QA staff? Yes, I mean, obviously we're going to work with all of the chapters on how to improve communication and increase the board involvement and in oversight in terms of these quality metrics. But we're going to start with formalizing the process for doing that, and then we can work on the formal implementation of making that occur. A question came in, where will CSS be reported? CSS is something that we actually discussed quite a bit. There is no special category for CSS, but individuals, as we discussed, individuals who are in the CSS program, if they're receiving day program or day services, they would be captured in that metric. If they're receiving residential services, they would be captured in residential component. So there is no separate category for the CSS in and of itself. Okay. There's a question and a comment about the QCC 100. We understand, that there have been some changes to the form. There have been, I guess chapters have been told to report deaths in IRMA, but we have not been provided a paper copy, electronic copy of the form or data that's been collected. I understand that question. There is a mechanism when you enter a death report into IRMA by which you can print out the information that you have entered into IRMA. I've sent out guidance on how to print out those reports a few times. I certainly can send that out again, but there's a functionality within IRMA that will allow you to print out those death reports in their entirety. Okay. Next question is, do FTEs include subs and temps? Again, you're going to be using the full-time equivalent number that you use in your CFR report. And I'm actually not aware of how those individuals are captured presently, but we're looking for full-time equivalent staff members as you would report in the CFR. One question, is NYSARC open to modifying the quality indicators? Yes, we're open to all of your feedback, even though we're having some difficulty getting it today. You certainly can send me an email, but all of this is open to review and consideration because we're really starting down a path that really hasn't been traveled before. So if you have some thoughts on how we can do this in a better way or a different way, I don't view it as criticism. I'm welcome to hearing it, and I encourage you to reach out to me. Okay, one question came in. For the data metric, number 7, will you be requesting the number related to police contacts only? Fire alarms, minor accidents, no injury? No, we're actually only asking in data point number 7 for those times where the police respond in person to the facility for an incident or an occurrence. Another question, we already do most of the information being requested. Would state ed, OCFS audits, SSA audits, would they be included in the evaluation form submitted to NYSARC? No, we're not looking specifically for those types of audits in terms of the data that's being reported back to NYSARC, but certainly you could absolutely and should incorporate how you're handling those types of audits and responding to deficiencies and concerns as they're being identified, and that would come through in your quality improvement plan. Okay, February may be too early to submit the QIP, particularly in relation to incident data from the prior year. That's good feedback. I will be discussing this with our quality standards professional work group and seeing what is a more reasonable time frame to get that data in to us. And if it's too close of a time frame, we certainly can expand it. We have some time to play with that date. Is there a category for MSC? That's a very good question. I personally, I haven't asked the professional work group the question. I personally would probably include that in like a day service. It certainly is not a residential service. There will not be a separate category unless we make one. So I'm gonna hold on that answer until I consult with the professional work group. The final question that we have, do we want the total number of both 624 and 625 deaths, as both require QCC 100s? Now, that's a very good question. Our guidance at this point is if you complete a QCC 100, regardless of whether it's a 624 or a 625, we would like you to submit that to state office within 5 business days of the discovery of the death. Okay, there are no other questions that I see.
Yeah, Eric?
Yeah.
Yes, I would just like to reemphasize something that you said a few moments ago, and that is your feedback and continued discussion is totally welcome. None of us has a corner on this quality assurance, quality improvement process. And so we really want this to be interactive, and we want the benefit of your wisdom and experience in the doing. So please get back.
Good.
As we continue to move through this process, that interaction is going to be critically important.
Okay. I will be getting out the PowerPoint to everyone, as well as some additional materials and guidance in the upcoming days. Thank you all very much for participating. Feel free to reach out with me. I apologize for some of the technical issues that we had in terms of the interactive nature of this. We will certainly work that out before the next conference. Again, thank you all for your commitment to moving quality forward within the organization.
Yes, thank you. Thank you, Eric.